From Nasdaq's market site, I'm your host, Kristina Ayanian. And joining me today is CEO of DocGo, Lee Bienstock. Lee, thank you for joining us. Welcome.
It's great to be with you.
Great to have you. Now, DocGo has really positioned itself as a leader in proactive healthcare. When we think about proactive healthcare, we often think of technology-driven solutions. How is DocGo's technology-driven solutions increasing healthcare accessibility and improving patient lives?
Yeah, so technology is foundational to what we do. At DocGo, we bring care to where it's needed, when it's needed. We're a mobile healthcare company. We're probably one of the largest mobile healthcare companies in the country today. We actually serve many hundreds of thousands of patients in the UK as well. And really our goal is to bring care to where it's needed. That's our big idea, proactively. And we've done a wonderful job doing that. To date, we've seen almost 8 million patients since we started. We have a team of 5,000 clinicians that are out in the field every day serving patients in 1,000 mobile vehicles. And really our goal, again, is to meet the patients where they are. It's almost an idea as old as time. The doctor used to come to you when you're sick. The place you want to be is home. The place you want to be is where you are. And we enable that. We bring care to patients' homes. We bring care to where they're needed. And we're doing it at massive, massive scale. We're very proud of that. The only way to really do that efficiently and profitably is to do it with technology. And so what we do is we've built our own proprietary technology platform that allows us to manage all of those units and all of those clinicians in the field and optimize all of their patient visits so they're seeing the right patient with the right vehicle, with the right clinician, with the right licensure. That beautiful symphony that's happening in the field every day is managed by our proprietary tech platform. And then our clinicians in the home have a suite of technologies that allow us to listen to the patient's heart, to look inside the patient's ears, nose, and throat, to take various diagnostics that we may need so that we can deliver proactive care to them. And really, Kristina, it's wild to think in the US by 2030, almost 2/3 of all Americans are going to be living with a chronic condition. Over 150 million Americans. And 1 out of 4, think of this, 1 out of 4 Americans today don't even have a primary care doctor. So really what's happening is patients are ending up in the hospital, they're accessing care when it's an emergency, and that's really not what anybody wants. That's not what this healthcare system wants. It's certainly not what patients want or need. And so our goal is to bring them proactive care, meet them in the home, provide care to them before it becomes an emergency or before they land in the hospital, and we're doing a tremendous job of that. Just last year alone, we saved the emergency room system over 50,000 visits with our proactive care, so we're very proud of that.
That's incredible. Congratulations on all that growth. The numbers speak for themselves. So as healthcare systems are shifting towards a more value-based care approach, how is this benefiting DocGo?
Yeah, so value-based care is all about shifting the system, not to reward fee-for-service. The healthcare providers get paid for every test they do or for every diagnostic they run, but rather to incentivize whole patient care, to manage the whole care continuum, to make sure that patients are healthier, and when they're healthier, they actually cost the system less money. We actually was reading a peer-reviewed study that showed just one primary care visit lowers the total cost of care by $4,000. Wow. So really value-based care is about lowering the total cost of care, making patients healthier. That's really where the whole healthcare industry is going today. And so our goal really is we are entering into value-based style arrangements where we're helping health insurers and the health systems and health plans and hospital systems really meet patients where they are, lower the cost of care, because again, we're catching patients before they end up in the emergency room. That's our goal. Those 50,000 patients that I mentioned that we saved from going to the emergency room, that saved the system over $160 million. So the whole goal is, again, to catch patients, help keep them out of the hospital before it precipitates into an emergency. And so that's really what value-based care is all about.
You're really creating a more equitable healthcare system. How are you increasing accessibility, increasing healthcare accessibility for underserved populations?
Yeah, so again, in our mission, we want to bring highly affordable, highly accessible, great quality care for all. We included for all. We want to make sure that we're serving all of America and the UK that needs care. So really our mission is to bring care to where it's needed, and we work with municipalities, we work with hospital systems, we work with payers to bring care to all of their patients. As an example, we're rolling out right now a massive deployment in California where over half of those patients that we're working with a large insurance provider, they don't get access to the care that they need. Over half of them. And so really, everyone thinks of California, oh, the large city centers, but there's also more suburban, rural areas of California that we're also bringing care into those communities that don't have great access to care. That's what mobile is all about. It's dynamic, and we can bring it to the areas that need it when they need it. And so in many areas of California, as we're expanding right now, we're bringing care to those underserved communities as well, and we take great, great pride in that.
That's amazing, a very mission-driven approach.
Absolutely.
Now, insurance payers are being impacted by changes to their plan ratings. How can DocGo help their payers improve these quality metrics?
Yeah, so insurance providers, as I mentioned, they are the quintessential value-based provider, right? They want their members to be healthy. The healthier they are, the cheaper they are to care for, and obviously the better the insurance company is able to manage that. So really the way we're working with insurance companies is bringing care to their members, and they identify members that have not received the access and they have significant care gaps that need to be closed. As an example, perhaps a patient needs a colorectal cancer screening or a bone density scan or a diabetic retinal exam. We're going into the homes and providing those care gaps on behalf of the health plans. And again, the hope is that if we go into the home and provide a diabetic retinal exam, as an example, patients with diabetes are at risk for vision impairment or even blindness. And you can imagine it's horrible for the patient, but also costs a lot more to care for patients as their conditions get worse and worse. So our goal for the health plans, we partner with them and we go into the home, we do that scan, we do that care gap, and we identify that the patient needs additional follow-up care, and we're helping our payers and our patients basically close those gaps in care. And if we close many gaps in care, then the health plans will get a better quality rating because they're serving their members better and ultimately bringing their costs down. So we've seen over the past earnings season, many of the health plans are grappling with higher utilization. Their members are using the system more and more. The more they use it, the more expensive it is on the health plans. And we see their star ratings coming down, their quality metrics coming down. And so we help them specifically with that. We are helping their patients before they end up in the emergency department. We help their patients before their condition gets much worse. And of course, we want to help them with their quality ratings. As they close these care gaps, their quality ratings go up and the performance of their plans goes up as well. So we feel like we're in this wonderful confluence of we're helping the patients, we're helping the plans, we're helping the healthcare system, and that's where we play.
It really is life-changing work.
Yeah.
What is some of the feedback that you're getting from the market?
Yeah, so the feedback we're getting from the market is amazing. As for me, leading the company, I think of we serve many markets. First, we serve our patients. That's the most important for us. And the patients absolutely love the service. We have net promoter scores of over 85, which in the healthcare industry is significantly higher than the industry average. And so our patients love the service. And you can imagine, if you've ever been in the hospital, you just want to be home. You just want to get home, and we help care for their patients, our patients in the home, and they love that. So the market feedback from the patients has been incredible, meeting patients where they are. Again, an old idea, but hard to do in healthcare, and we're doing it. I think from a financial markets perspective, we're starting to see investors really look at what we're doing and saying there's tremendous value that we're creating for the healthcare system. And of course, we'll do well as we help bring healthcare costs down, as we help patients get healthier. There's going to be a lot of value that can be unlocked there. And so we're right in the middle of that. And investors are very, very excited about that. And I would say as well from our own employees, that's some group I care deeply about. Our employees love working for the company. We're one of the great companies to work for. We have the highest ratings on Indeed and Glassdoor, and our clinicians are the heroes in the story. They're out in the field, they're serving patients, they're active, they're going from serving at the top end of their licensure and going and serving patients, and so they're very, very happy. They're active and they're the heroes in the story. They're certainly the heroes in our story, and so they're very happy as well. So from our patients to our customers to our employees to our investors, we're seeing a lot of great market reaction, and the customers, like I said, they like it as well. Municipalities really have an obligation to serve their underserved populations. We help them do that. Hospital systems really want to free up the hospital beds for the patients that truly need their hospital beds. We help them do that. And of course, our payer partners, like we talked about, we help them manage their members to lower the total cost of care, close care gaps, serve patients in their homes. And so the municipalities we work with, the hospitals we work with, and the payers we work with absolutely love our services as well.
That's amazing. You're really proving that purpose meets profit.
Exactly.
Lee, thank you so much for joining us. Thank you for all the work that you do for your patients, and we look forward to following your continued growth.
Thank you, Kristina, and thank you to Nasdaq.